Bonjour Dr Grant, merci d'avoir choisi l'IETSP pour présenter pour la première fois en France une nouvelle thérapie tout à fait intéressante pour les professionnels de la santé et qui est le BRAINSPOTTING. Voilà. Donc merci d'avoir choisi notre institut, représenté par Bernard Mayer et moi-même, professionnels de la santé, pour former à leur tour les professionnels de la santé après les États-Unis et l'Europe. Docteur Grant, est-ce que vous pouvez nous dire quelques mots sur le BRAINSPOTTING et quel est votre parcours et qu'est-ce que le BRAINSPOTTING?
Could you please introduce yourself and tell us what BRAINSPOTTIng therapy is about?
Well, I'm a psychotherapist from New York City, and I'm the discoverer and developer of BRAINSPOTTIng. BRAINSPOTTIng is a brain-body-based technique that works directly with people for psychotherapy, especially for conditions of trauma, people who've had traumatic experiences. I discovered BRAINSPOTTIng 11 years ago, and since then I've trained people around the world, and it was a great pleasure and honor to come here and train French therapists for the first time. We have over 7,000 therapists trained in BRAINSPOTTIng, and we just added 40 new ones here in Paris, France.
Thank you.
David, est-ce que vous pouvez nous expliquer la spécificité du BRAINSPOTTIng et quelle est aussi sa validité scientifique?
Well, as I said, BRAINSPOTTIng is a brain-body-based technique, but at the same time it's a relational technique. And the history of psychotherapy, going back to Freud, the essence of psychotherapy is the relationship, which is really the centerpiece of which is the therapist listening to the client, really taking what the client had to say. And I was originally trained in psychoanalytic psychotherapy, but as I've learned in the last few decades, the brain and the body is central to the psychotherapy process. So with BRAINSPOTTIng, what we combine is attunement, or listening to the client very closely, and also attuning to their brain and their body, both in terms of, with BRAINSPOTTIng it has to do with where people look, which indicates also what's going on inside, but also what they're feeling in the body at the same time. BRAINSPOTTIng really can be used with any person who comes for psychotherapy. On the one hand, everybody has traumas in life, and anybody who goes to a therapist's office, even if it's not specifically for trauma, if they're coming because of anxiety or depression or behavioral problems or relationship problems, there's always trauma there that is affecting them, and there are traumas that go back to childhood, even though they're not a major trauma. But in reality, everything that goes on for us is in our brain and felt in our body. So at the same time as BRAINSPOTTIng therapists listen closely to their clients, they're also aware of what the client is feeling in their body, and they're also attuning to where this is going on in the client's brain, which we get specific access to by where they look in their visual field. In other words, if somebody is really upset about something, and they look off to their right, or they look off to their left, they'll feel it usually a lot more on one side and less on the other side, which gives us some idea of where they're holding it in their brain.
Merci beaucoup. Et je vais vous poser une question peut-être un peu simple, mais c'est pour nos amis praticiens français et aussi nos patients. Peut-on traiter des cas aigus ou des cas aussi chroniques très anciens avec ce type de thérapie?
Can this kind of therapy treat also very acute injuries or very old, traumatic, chronic?
Again, there's basically two types of trauma. We call it post-traumatic stress disorder. There's acute trauma and there's complex trauma. Acute trauma comes from a single traumatic event, or sometimes two. And as severe as it is, it's only held in one part of the brain. And it's actually the easiest form to treat. An example of that would be if you were attacked on the street, or if there was a natural disaster, or something else that you were exposed to. But otherwise, you're not carrying a lot of trauma. Complex trauma, or PTSD, comes from people who've had a lot of traumas in their lives, usually going back to childhood. In psychotherapy, talk therapy is very limited in its ability to affect traumas, even acute traumas. But in brain spotting, with the specificity that we have in locating through the visual field where the person is holding the traumas in their brain, that they feel in their body, we're able to, with great precision, locate and help the person to process or heal and release these traumas. Now, with complex trauma, especially going back to childhood, it takes more time because there's so many different traumas to process and because they're really distributed throughout the person's brain. But at the same time, brain spotting can identify these with such precision and help the person's brain and body to heal itself that it takes much less time than most psychotherapies.
Et est-ce qu'il y a d'autres champs d'application du brain spotting, comme par exemple pour les sportifs ou performer on pourrait dire le champ d'action des acteurs dans votre expérience aussi, dans le coaching?
In terms of performance, and specifically sports and creative performance, brain spotting definitely has its place. One thing that's really not known is that most athletes and most artists actually are carrying their own personal trauma. And when you have trauma inside, it actually can block you from being able to be who you can be as an artist and to perform as you can perform as an athlete. Literally, movement is something that's part of all athletics and it's part of all art forms. The first thing that we do is to look for what the person's traumas have been in their life and also in their endeavor. If it's athletes get traumatized all the time playing their sports, football players get injured, sports injuries, and it happens for every sport. So those are traumas as well, and we look to identify them and help them to heal. But once we do that, then we have a chance to go into what we call expansion. With brain spotting, you can take a person who's functioning at a good level or even a high level and help them to perform at a higher level because we can locate through their field of vision where they have their greatest talents and the greatest abilities. With creativity, it's also the case. There's a myth that for artists and actors that if you heal your traumas, you're going to lose your creativity. And it's a total myth because in fact, trauma does not inform creativity, it blocks creativity. So when we heal the traumas of artists, they actually can be much more expressive in wider and deeper sort of ways than they were before. But I very specifically have developed brain spotting as a technique for acting coaching, which I use a lot, and it's very exciting. What we do is, for the actor, the most important thing is to get into character and go deeply into character. Feel the character's emotions and feel the character in their body. So with an actor who's preparing for a role, which can be an audition or stage or television or camera, we find the spot where they feel the character the most. And once we find that spot, the actor starts to go deeper into character and actually starts to remember things from their own past, but they're not from the actor's past, they're from the character's past. So there's a spontaneous creation of emotionally and bodily felt memory that actors experience during brain spotting acting coaching.
Merci beaucoup David, et d'autant plus que vous faites des formations partout à travers le monde et que maintenant en France, nos collègues français commencent à être formés car il y a une formation avancée qui commence, on pourrait dire, dans le monde francophone.
Well, I want to really thank you for bringing me to France, and I want to say that now we have our first class of French brain spotting therapists of 40 therapists, which means that French people, people in Paris and around France have a chance to go and receive brain spotting therapy, which is very exciting to me and it's a great honor to me.
Merci beaucoup.
Merci, Dr. Grant. Et nous rappelons donc que vous pouvez suivre le programme des formations du Dr. Grant sur notre site www.ietsp.fr où nous proposons régulièrement des formations du Dr Grant et de son équipe.
Et vous aurez toutes les informations pour pouvoir, que ce soit nos collègues du monde de la santé, bien sûr, en tant que professionnels, et aussi, on pourrait dire, pour les patients qui veulent connaître, mettre un nom, un visage sur le Dr Grant, merci, vous avez cette vidéo et vous avez sur son site aux États-Unis. Pouvez-vous nous donner votre site américain, s'il vous plaît, Dr Grant?
It's brainspotting.com, just like brainspotting and .com. It's in English, so we don't have a French version yet, but we certainly will be developing it in French and other languages.
Et je crois même que vous avez un congrès en 2016 au Brésil.
We're going to have our first Congress in February of 2016, where brain spotting therapists are going to come from all the world, and hopefully there'll be a nice, large French representation, where brain spotting therapists from around the world will be able to meet and study together.
Voilà. Nous vous remercions et puis bon séjour à Paris.